Coming to the general surgery, which of the following is the Millard's rule of 10? It includes all except. Is it 10 pounds or 10 weeks or 10 gram percentage of hemoglobin or 10 months? So Millard's rule of 10 includes 10 weeks of age, 10 pounds in weight, 10 grams of hemoglobin. So it accepts 10 months. So Millard's rule of 10 includes these three. That is 10 pounds, 10 weeks and 10 percentage hemoglobin. A wide and palpable fissure during fixation is von Graffi sign, Cocker sign, Dalrymple sign or lag of thymus. Here the answer is Dalrymple sign. So the wide and palpable fissure during fixation is Dalrymple sign. Averted and pulled out margin seen in basal cell carcinoma or squamous cell carcinoma or trophic ulcer or tuberculous ulcer. Here the answer is squamous cell carcinoma. So averted and pulled out margin seen in squamous cell carcinoma. So what is an ulcer? It is a break in continuity of the covering epithelium, either skin or mucous membrane due to molecular death. So these are the parts of ulcer. Here it is the edge of the ulcer. This is the floor of the ulcer. And this is the margin of the ulcer. And finally, this is the base of the ulcer. This is the base of the ulcer. So which are the parts? First one is the edge of the ulcer, then margin of the ulcer, floor of the ulcer, and finally the base of the ulcer. So this is the ulcer and the parts of the ulcer. So which are the parts? Margin, edge, floor, and base. Okay, so this is the margin. This is the floor. This is the edge. And this is the base. So what are the types of edges? So this is the sloping edge. Here it is the sloping edge. And what is this type of edge? This is the punched out edge. This is the punched out edge. And what is this type of edge? Here it is the undermined edge. And this is the raised and beaded edge. So these are the various types of edges. Okay. And finally, this is the averted edge. So margin, edge, floor, and base. And these are the common type of edges. First one is the undermined edge. So first one is the undermined edge. So undermined edge is seen in tuberculosis. Okay. So undermined edge is seen in tuberculosis. Then coming to the punched out edge. So punched out edge is seen in syphilitic ulcer or deep trophic ulcer. Then coming to the sloping edge, it is seen in healing, traumatic, or venous ulcer. Then coming to the raised edge, it is seen in rodent ulcer, that is basal cell carcinoma. Coming to the rolled out edge or everted edge, it is seen in squamous cell carcinoma or ulcerated adenocarcinoma. Then coming to the shallow edges, it is seen in venous ulcers. So these are the types of edges. First one is the undermined edge. It is seen in tuberculosis. Then punched out edge is seen in syphilitic ulcer or deep trophic ulcer. Then coming to sloping edge, it is seen in healing traumatic or venous ulcer. Then raised edge, it is seen in rodent ulcer, that is a basal cell carcinoma. Then rolled out or reverted ulcers or edges seen in SCC, that is squamous cell carcinoma or ulcerated adenocarcinoma. Then shallow edges is seen in venous ulcers. Okay. Coming to another important question, that is which are the painful ulcers and which are the painless ulcers. So it is frequently asked MCQ questions. So which are the painful ulcers? Tuberculosis or tuberculous ulcer, then arterial ulcer and advanced malignancy. So these are the painful ulcers. And what are the painless ulcers? Syphilitic ulcers, then trophic ulcer and early malignancy. So painful ulcers are, which are the painful ulcers? Tuberculous ulcer, arterial ulcer and advanced malignancy. And painless ulcers are syphilitic, trophic ulcer and early malignancy. So advanced malignancy is considered to be painful and early malignancy is considered to be painless. Okay, remember this. And tuberculous ulcer is also painful and also arterial ulcer. But painless ulcers are trophic ulcer, early malignancy and syphilitic ulcer. Okay. What is lucid interval and what is it seen in? It is in subdural trauma or intracranial trauma or extradural trauma or subarachnoid trauma. So lucid interval is seen in extradural trauma. So next question. During laryngeal airway, because of use of muscle relaxant, which muscle may be unable to keep glottis open? Is it posterior cricoarytenoids or anterior cricoarytenoids or cricothyroid or cryopharyngeus? So here the answer is cricothyroid. Preferred site of injection, gluteus muscle. So in gluteus muscle, which is the preferred site of injection? It is superior lateral or supramedial or infralateral or inframedial? Here the answer is superolateral. So superolateral is the preferred site of injection, gluteus muscle. The next question. What is bed sore? And what is it? It's an example for trophic ulcer or gummatous ulcer, Marjolin's ulcer or rodent ulcer. So bed sore is an example of trophic ulcer. Best location for intravenous injection. Is it a cephalic vein or distal vein or median cubital vein or radial vein of fora? The best location is the median cubital vein. So median cubital vein is the best location for intravenous injection. Moon's molar seen in or in which condition? Is it leprosy or syphilis or amyloidosis or actinomycosis? So Moon's molars, it is seen in syphilis. The lid retraction, it is seen in which condition? Is it thyrotoxicosis or hypothyroidism or hypoparathyroidism or hyperparathyroidism? Here the answer is thyrotoxicosis. So lid retraction is seen in thyrotoxicosis. So lid retraction, what is lid retraction? It is seen in thyrotoxicosis. So it is a prominent ophthalmologic sign seen in thyrotoxicosis. And most common signs of Graves' disease is, so for Graves' disease, upper eyelid retraction is the most common sign of Graves' disease. Okay, most common sign of Graves' disease. And what is a von Graffi sign? What is von Graffi sign? So von Graffi sign is lid lag on infraduction. That means rotation of eye around its horizontal axis so that it looks downward. This is known as von Graffi sign. And what is Cocker sign? Cocker sign is eye globe lag on supraduction. Okay, that is Cocker sign. Then what is a Dalrymple sign? So what is the Dalrymple sign? It is the widened palpebral fissure during fixation. This is the Dalrymple sign. So Dalrymple sign is the widened palpebral fissure during fixation. Then coming to lag ophthalmos. What is lag ophthalmos? It is the inability to close the eyelids completely. So this is the lag ophthalmos. So these are the various signs. Cleft lip is formed by non-fusion of medial nasal process and lateral nasal process, medial nasal process and lateral palatine process, medial nasal process and maxillary process are all of the above. Here the cleft lip, which is formed by non-fusion of medial nasal process and maxillary process. And due to non-infectious agent, the which gangrene is caused? Is it wet gangrene or dry gangrene or pyoderma granulosum fourniers gangrene? So this is the gangrene which is due to non-infectious agent. So which is the gangrene due to non-infectious agent? So here is the answer, that is fourniers gangrene. And what is what are the causes or the it is also known as, what is the other name for fourniers gangrene? It is known as necrotizing fasciitis. Okay, and it occurs due to various infections like streptococci, staphylococci, enterobacteria, anaerobic organisms, and fungi. And what is the wet gangrene? So what is wet gangrene? It is due to sudden occlusion of blood supply or an emboli Okay, so that is the wet gangrene. And what is dry gangrene? It is due to gradual cessation of blood supply. Gradual cessation. Example of wet gangrene is atherosclerosis. And pyoderma granulosum is a chronic neutrophilic inflammatory disease due to impaired immune function of neutrophils. So the pyogenic granulosum is involved in impaired function of neutrophils. So here the example of pyogenic granulosum is Crohn's disease, arthritis, etc. Okay. So these are the various types of gangrene. In secondary thyrotoxicosis, which of the following should be avoided? Is it FNAC or MRI or thyroid function test or thyroidectomy? Here the answer is thyroidectomy. So thyroidectomy is should be avoided in secondary thyrotoxicosis patients. Okay. Then due to ingestion of which compound angiosarcoma is caused? So angiosarcoma is due to the ingestion of, is it PVC or acrylamide or chromium or mercury? Here the answer is PVC. So angiosarcoma is caused by ingestion of PVC. Patient with cystic lesion on outer canthus of eye is meibomian cyst or sebaceous cyst or teratoid or dermoid cyst. So here the answer is dermoid cyst. Then malignant transformation in a long-standing scar is rodent ulcer or trophic ulcer or gummatous ulcer or Marjolin's ulcer. Here the malignant transformation in long-standing scar is Marjolin's ulcer. And that's all for today. And please do like, share and subscribe my channel for more videos. And thanks for watching.